All of us are familiar with the phrase, physician, heal thyself. But where did this saying come from? The most modern way of finding out is to access the resources on the internet. Using a web browser, you can have the answer in seconds. In this program, we'll examine the structure of the internet, discuss the equipment you need to gain access to it, and examine the net in the lives of physicians. The most common use is for sending email, but participating in electronic discussion groups and exploring the latest in medical information are also popular activities. After viewing this program, you will be able to describe the structure of the internet, list the pieces of equipment needed to access the internet, discuss the use of email to transfer medical information, define the legal issues when a physician participates in a general access electronic forum, and describe the steps in accessing information on the World Wide Web. Our guests include Dr. Jerome Osheroff, a Clinical Information Management Associate at the American College of Physicians. Dr. Osheroff is an authority on information management and the use of computer technology in medical practice. He recently edited a book called Computers in Clinical Practice, which is a comprehensive overview of using computers to effectively improve patient care. Dr. Robert Kopika, an internist in Arlington Heights, Illinois. Dr. Kopika uses a variety of medical knowledge tools to access clinical information. Dr. Frank Meisner, Chief of Cardiology at the David Grant Medical Center in Travis, California. Dr. Meisner has been involved with computers for over 30 years and oversees the Medical Information Forum on CompuServe. The Internet is a computer network. It began in the late 1960s when the Department of Defense linked together 4 computers at academic institutions in California and Utah. The goal of the project was to provide an alternative communication system in the event of nuclear attack. Realizing that they could share computer resources, other government departments and universities joined the network. Developments in computer technology and a growing interest in the Internet has led to its being open to commercial organizations and private individuals. An estimated 40 million computers are now connected to the Internet, and the number of users grows by at least 10% each year.
The Internet is a network of networks, so computer networks in academic centers and hospitals and businesses. There are local networks, and the Internet is a protocol for those networks to connect with each other and exchange information.
You need 3 things to connect your personal computer to the Internet. 1, a modem with a speed of at least 14.4 baud rate. 2, a telephone line. Note that a digital ISDN line provides much faster download. And 3, a service provider to connect you to the Internet. Now, some service providers are commercial online services such as Prodigy or America Online. The Internet provides access to many different resource tools. The most popular one is electronic mail. It's called email for short. There are other uses, and they include Usenet newsgroups, which are electronic forums on specific topics that permit postings of public messages, and information access. Each Internet site has its own address, the Uniform Resource Locator, called the URL. The URL indicates the location of the main computer and the type of organization or institution that owns it. For example, the URL, or the address, for the server computer at Reuters Health Information Services is www.reutershealth, that's one word, .com, C-O-M. This tells you that you are connecting to the worldwide website at Reuters Health, which is a commercial, C-O-M, organization. Other categories of sites are EDU for educational, GOV for government, MIL for military, NET for network, ORG, org for organization, and INT for international.
It's been said that the Internet is something like drinking from a fire hose, that you have so much going past you that sometimes getting even a little bit out can be a problem. And oftentimes you'll find that your searches will bring a large amount of information in. Generally, you find, though, there's a learning curve involved, and after some time and experience on the Internet, you'll get to a point where you can find the information you're looking for relatively quickly. Once you've located that information, most software allows you to mark the location, so you can return to it easily in the future, and even, or you can also choose to download some of the information, keep it locally on your computer, and print it off that way.
Email is the most frequently used service on the internet. It is most cost-effective to write an email offline on your PC, then access the internet to send the message. Emails are transmitted in a matter of seconds, and they cost about the same as a brief local telephone call. A message may be sent to one person or to a selected group of people at the same time. An email can include text, documents, graphics such as slides, sound files, and even video clips. Emails can be printed out on paper by both the sender and the recipient, and the hard copy can be stored as a permanent record of the exchange, so it can be used for documentation.
There's two basic kinds of medically related email that is particularly interesting or important. First of all, there's email between colleagues for exchanging information about patients, asking and answering clinical questions and the like. The other type is email exchanges between patients and their physicians. One of the reasons why email between physicians is something that's becoming increasingly popular is because it avoids the problem of telephone tag. Very often the kind of information that you're looking for is something that can wait a day or so, the amount of time that it might take for somebody to get back to you. The problem with using email for that purpose is it's like the catch-22 in the early days of telephones, that not everybody uses email every day, so there's a limited number of people that you can talk with, but that number is something that's growing very, very rapidly. When physicians need to do things like give patients information about what their test results were or making changes in medication, getting that information to patients can potentially be more efficient. Managed care organizations, laboratories, payers, etc., all both consume and generate data about patients. So electronic mail and the exchange of electronic files using tools such as the internet can facilitate this exchange of information. One of the manifestations of this kind of more broadly based information exchange is in something called CHINs, or Community Health Information Networks, where hospitals and clinicians and patients and managed care organizations, payers, and the like are all connected via a community-based network, which is essentially internet-based.
Discussion on the internet covers thousands of topics and special interests and is open to a global audience 24 hours a day, 7 days a week. In a news group or a forum, messages are saved in a common area, so anyone with access to the host system may read posted messages and add their own.
On some of the private commercial networks, things like CompuServe, America Online, or Prodigy, these are networks that are closed in the sense that you have to be a member to join, you have to pay a membership fee, some kinds of ongoing charges for use of the network. These have their own forums and bulletin boards implemented with their own proprietary software. Commercial online networks all have connections to the internet, which enable their subscribers to exchange email with other folks who are on the internet and to access some of the internet functionality like the World Wide Web and the internet discussion groups.
Medical news groups may be open to physicians only, such as the Geomedica Forum and ACP Online, both in CompuServe, or open to the general public, such as the MedSig Forum on CompuServe. It is important to be aware of the difference. Specific advice offered to a patient in a general access news group can be open to issues of negligence and liability similar to an office visit.
There are discussion groups that are devoted specifically for the purpose of clinicians interacting with other clinicians about medically oriented topics. These closed discussion groups provide the opportunity for physicians to speak candidly and openly about questions and concerns that they may have without the concern that patients are going to be participating in the discussion or listening into the discussion. Geomedica has a private forum available for their subscribers, which is yet another environment where clinicians can exchange ideas and questions with each other in this closed type of setting. ACP has its own online forum, which is accessible only to internists who are members of the American College of Physicians. And this network is a very active environment where ACP members ask each other questions about challenging issues that arise in their practice. They discuss issues about medicine in general, about how physicians are dealing with the advent of managed care in their own particular settings, and a variety of other topics of interest to a closed community such as ACP members.
I'm the primary SysOp of MedSig, and MedSig is the medical information forum on CompuServe, which is one of the major information services. I do that in a volunteer standpoint, and basically I found that I get so much out of hearing other people talk about their own experiences interacting with patients, interacting with nurses, interacting with allied health professionals, interacting with other doctors, that I find out what's important in the area of medical informatics. I find out what's important in medicine. I find out what the concerns of patients are. I find out what the thought processes and concerns of healthcare managers and HMO directors are. Sometimes we even have people who are, legislative, from a legislative standpoint, talk about those terms. Now, there's a bias, of course, but by the same token, there's an incredible richness of voices and viewpoints.
As you might imagine, patients' use of these forums and bulletin boards can present a double-edged sword to their clinician who cares for them. On the one hand, they tend to make patients more sophisticated, more educated, more active participants in their own health care, which can be a very valuable asset to the doctor-patient interaction. It's important to note that the notion of legal liability and other challenges like that are not lost on the people who maintain and administer these news groups. So not infrequently you'll see warnings that advise against doctors providing patient-specific information on a forum or news group, just rather offering general opinions and comments about a particular disease entity or therapeutic procedure.
The World Wide Web is the fastest growing service on the internet. There are several software packages called web browsers that allow the user to access and search the web. The most notable feature of the web is called hypertext. This is where there are highlighted words or phrases that are linked to other files, graphics, sound, or video clips.
So the World Wide Web is a piece of the internet. It isn't the internet per se, but it is a protocol like all the other protocols, and it is at this point in time the dominant protocol on the internet. Now there are problems with it, but it's so easy to use that any child can use it, and because any child can use it, most of us adults can sort ourselves through it. Okay, and we're able to play with it and learn from it and make mistakes and not have a smoking cathode ray tube and a trash system. So that's what's driving people to the use of the internet.
Navigating the internet can certainly be at first a daunting and almost endless challenge. Most of the software you'd buy usually starts off with a initial page. They call it a home page. And that home page will help you navigate to other home pages. Most of these are interlinked even further, so you can get around simply by just pointing the arrow on your mouse and clicking. There's also several search functions available on the internet, and you can type in free text searches or other particular items of interest that might lead you to an appropriate spot.
There are several directories like that that are available and are devoted to healthcare. Another way of looking for information on the web is via searching engines. There's a variety of different kinds of search engines that are available that enable you to type in a particular term of interest, and the search engine goes out and finds websites where that term is applicable, either because it's used in the title of the website or in one of the documents in the website and the like. These tools are increasingly becoming available. They're powerful to use and can be very helpful in locating information that's of interest. Another phenomenon that's unfolding is as the web becomes more and more ubiquitous in society, when you look through magazines and the like and advertisements, you very frequently will find pointers to worldwide websites. And this phenomenon is also appearing with medical journals. Sometimes you can find references to electronic versions of printed documents referred to right within the text of journal articles. One feature that most, if not all, of the popular World Wide Web browsing tools have, and by browsing tool, I mean an interface that enables you to locate specific documents or files, etc. Most browsing tools have a function that once you visited a site, you can create an electronic bookmark. And what that bookmark does is it keeps track of the electronic address or the URL of the site of interest. So for example, if you suspect that in your practice you might want to periodically refer to the NIH consensus statements or periodically refer to the U.S. Preventative Task Force's guidelines or et cetera, any site of interest that you feel you may have reason to return to in the future, you can create this electronic bookmark, which makes it very simple to access that site again simply by clicking on the appropriate title for the bookmark that you've created.
Examples of medical sites on the web include the Travelers Clinic site at the Medical College of Wisconsin, the AHCPR Guidelines site, the Virtual Hospital, and our own site at Reuters Health.
The screen we're looking at right now is from a Travelers Clinic that's run at the Medical College of Wisconsin. In primary care, you're oftentimes encounter a patient who may be traveling and may have particular questions. One option would be to access some of the information on the internet. So you come to the particular homepage, as it's called, and you can see that there is a area that lists travel health information. Simply clicking on that brings you to a separate listing that includes a short description of hepatitis A. You can then again click on the hepatitis A, and it'll give you a full text of the recommendations for the particular use of this vaccination. The vaccination recommendations are written by a particular doctor, and he has put his name at the bottom. Again, what you're seeing here is a physician who's gone through the literature, who runs a travel clinic, who attempts to keep things up to date. Recently, at a nursing home where I serve on the Quality Assurance Committee, discussion of bed sores and their prevention came up. One of the guidelines available about this is available from the federal government through their AHCPR. They, like many other federal government agencies, are on the internet, and the guideline is available there. What we've done is come to the actual homepage of the AHCPR and looked at their guideline section. It is kind of unique because they have, with the guideline, not only a section on the two guidelines, but also oftentimes they will include a short text summary for patients or family members who might be concerned about these things. The guideline itself is in two types: a clinical practice guideline, which is a long depth version, and a shorter quick reference guideline. This guideline can be obtained simply by clicking on the point here. Once you come to this screen, you can see that the table of contents is spelled out clearly, and you can just simply go to whatever you find of interest. The text itself is brought to the screen, and more importantly, it can be either printed out for distribution, or it can be stored into the computer and then later added to a guideline that you yourself might be working on for your nursing home, or it can be incorporated in a letter that you might be writing to clinicians, alerting them to be more diligent in prevention of these things. Sometimes when you're going through the internet, you come across things somewhat unexpectedly. In this case, I happen to be accessing a net site called the Virtual Hospital, which is at the University of Iowa. what I found here was an interesting lecture called The Top 10 Questions About Lung Cancer. We click on it, and then we come down, see that there's a subsection of the lecture which talks about, would a chest x-ray a year ago have found it sooner? This is a text file discussing how screening for lung cancer doesn't really help very much in terms of using a chest x-ray. And a text file like this, which could be printed out and would take maybe a page or so, could be given to a patient for some additional explanation about why I don't believe we need to do chest x-rays for screening at this point in time.
In many cases, you can rely on the source of the information to make some assessment about the underlying quality of the information that you're accessing. So for example, if you look up on the National Institutes of Health website things like the NIH consensus statements, you have a pretty good idea of what those information sources are all about based on your familiarity with the printed counterparts. Other things that you might have access to, such as locally developed continuing medical education programs or physician-specific protocols for how an individual manages certain patient problems, those kinds of things require much more careful attention to the source of the information, how familiar you are with the person or organization that developed that information, and of course a very careful review of the information itself to appraise its validity and applicability in your own practice. Several years ago, when the World Wide Web first became available, setting up a website to provide information about yourself or your business or your organization is something that took a fairly significant amount of expertise and investment in time and resources. More recently, setting up a website wherein you can provide information to people browsing and searching the web has become increasingly easy. In fact, as an example, CompuServe has recently announced the capability that they will shortly be providing their members to set up their own web pages. Physicians have already begun turning to the World Wide Web, setting up their own web pages, providing similar kinds of information so that if a patient calls and wants to know more about the physician's training or about office hours or the type of practice that the physician has, the kinds of problems that they specialize in, etc., looking for informational brochures that the practice distributes, physicians are increasingly referring their patients who are interested in this information to the physician's own website or the practice's website, or in some cases a large clinic's website.
Now, security on the internet is a major concern, and you hear a lot of talk about it. The system was originally designed to be an open system accessible to a few users. Today, any computer on the net theoretically is at risk for unauthorized access by information thieves called hackers, who aim to steal information or purposefully destroy files. Steps that can reduce the risk of this include using passwords composed of letters and numbers. The ideal password is a series of random letters and digits, but they can be difficult to remember. Try to choose a combination that's difficult to guess, but does not include numbers in your birth date, phone number, or social security number, any of which can be accessed by a hacker. Sensitive information such as patient records or subpieces of patient records should only be used on computer systems with documented security or should be encoded. Computer programs that are downloaded from a common source should be routinely screened for computer viruses. These are encrypted codes that can corrupt computer files.
Even though the World Wide Web provides a wonderful prototyping environment where you can demonstrate the concept of distributing medical records and medical knowledge ubiquitously around the globe, you can imagine the kinds of very crucial issues that this raises, things such as security, confidentiality, validation of who's accessing what information and if they have an appropriate reason to access that information. These are more cultural issues, or as much cultural issues as they are technological issues, and we haven't quite worked out the solutions to these problems yet. However, having the World Wide Web available as a prototype environment for raising these issues and beginning to explore technological solutions and cultural solutions to these problems will accelerate our developing systems that provide the kind of functionality that we need, but also deal appropriately with some of these problematic issues.
Accessing Bartlett's familiar quotations on the web shows that "physician, heal thyself" actually originated in the New Testament. There's a remarkable wealth of information on the web, medical and otherwise, for you to explore. The best way to learn now is just take the plunge and investigate the net on your own. The program you have just seen was produced for your continuing medical education. We sincerely hope that your interest in this topic does not end after you complete this program, but continues with ongoing commentary among you and your colleagues and the medical staff here at Reuters Health Information Services. We urge you to share your comments and questions about the content of the program with others in the medical community. You can do that by posting messages to the Geomedica Forum on CompuServe, or send us messages here to Reuters Health Information Services on our own website at www.reutershealth.com. We look forward to hearing from you, and we hope that you've prospered from this program. For Reuters Health Information Services, I'm Dr. Polly Atkins.